Today in Cannabis News, in Nevada, the Cannabis Compliance Board hosts a public forum to discuss the finalization of requirements for cannabis consumption lounges in the state. In Georgia, a state Senate panel fundamentally trashes a bill advanced by the state House designed to overcome a bottleneck that has stalled the state's medical cannabis system. And in Alabama, a proposal introduced in the state Senate would force medical cannabis retailers to mandate a negative pregnancy test for individuals of childbearing age. It's Thursday, March 24th, and this is your Trichomes Morning Buzz.
Broadcasting live from the Trichomes.com studios in Southern California, it's time for your Morning Buzz. We bring you late-breaking news that keeps you up to date with what's happening in the cannabis industry.
First up, the Nevada Cannabis Compliance Board hosted a public session this week to discuss the requirements for cannabis consumption lounges in the state, bringing them further down the path to launching. This week, the panel and the community at large discussed a version of the rules, debating issues such as cannabis portion sizes, container restrictions, and staff development. Throughout the event, participants raised queries concerning the registration procedure as well as social equity permits. Individual lounges will receive 10 permits, social equity candidates will receive 10 permits to encourage diversity in the sector, and dispensaries wishing to establish lounges would receive an unrestricted number of permits. When the panel is satisfied with all of the regulations, they will vote and, if necessary, schedule an additional session. The panel must complete the rules prior to anyone being able to register to operate a lounge. The first lounge is expected to launch by the end of the year, according to the panel. Next up, the Georgia State Senate Health and Human Services Committee basically trashed a bill advanced by the State House of Representatives designed to overcome a bottleneck that has stalled the state's medical cannabis system this week. Rather, the committee voted to adopt the same iteration that the state Senate as a whole had approved. The two proposals would nullify the procedure by which a state committee set up to supervise the system that awarded 6 businesses provisional permits to cultivate cannabis and process it into low-THC cannabis extracts last year. The procedure irked 16 unsuccessful candidates who threatened to sue to halt the system. The Georgia Department of Administrative Services would be required to publish a new application for requests before the year's end, which would be evaluated by an expert agency within the House iteration. The Senate proposal aims for a tighter timeline, mandating the Georgia Access to Medical Cannabis Commission to redo the process by late May, sans assistance from the DOAS. While the bill might be readopted by the Senate, disparities among the House and Senate proposals might send the proposal to a joint session panel in the last days of the legislative session to see if a consensus can be achieved. Last up, a proposal introduced recently in the Alabama State Senate would force medical cannabis retailers to mandate a negative pregnancy test for women of childbearing age, which is seemingly arbitrarily defined as 25 to 50 years old, prior to administering cannabis medications. The individual's doctor or an accredited medical facility designated by a registered physician in Alabama would be required to provide confirmation of the negative test, which would need to be certified within 48 hours of purchase as well. If an individual is not pregnant at the time and gets pregnant thereafter, she must report her pregnancy status to her registered certifying physician and shall be prohibited from obtaining medical cannabis throughout the pregnancy. The proposal also prohibits breastfeeding women from purchasing medical cannabis unless as a registered caregiver, and mandates retailers to be 305 meters or more away from an educational center, childcare, daycare institution, or university. The proposal specifies that retailers can only distribute and administer medical cannabis to a registered qualified patient or registered caregiver only after it has been tested and bears the label required for retail sale. That was today's Buzz. Thanks for listening. For more cannabis news and insights from industry professionals and a place to discuss these stories and others, visit trichomes.com. And be sure to catch up with all of our other cannabis industry-related podcasts like Hash It Out, Tech in Cannabis, or the International Cannabis Conversation, wherever you get your podcasts. For trichomes.com, I'm RJ Balde, signing off.